A beautiful afternoon to you, and many thanks for joining us on the program Healthy Living with yours sincerely, Oluiji Uihohai. Now, we always re-emphasize and let you know that health is wealth. When you're healthy, that is where you know you have somewhere to go to. You actually remember the clothes you have in your closet. You remember that you have a party to go to. And also, you remember that, hey, I need to wear a smile on our faces. All right, so today on Healthy Living with yours sincerely, we will be looking at access to affordable health care, reducing maternal mortality through health insurance. Now, someone, while I was preparing for this program, someone said healthcare is not affordable. So today on the program, we decided to bring in some experts, yes, that has to do with health insurances. A lot of persons don't actually know that this package is meant on ground, yes, for individuals, for family, for groups, and so on, to know that, yes, healthcare can actually be affordable. Yes, it can actually be affordable. All right, so quickly now, a survey that was being carried out in 2018, statistics report found that about 97% of Nigerians did not have health insurance. That was in 2018. Now, moving down to 2023, population medicine found out that health insurance coverage was 2.8%. All right, so looking at some factors that affect access to health insurance. Now, before we look at factors that affect access to health insurance, I could actually remember while I was in the hospital, you found out that especially those persons that are put to bed, yes, new mothers, they tend to get worried. How will I pay my hospital bills? How will I take good care of my young one? How will I do this and how will I do that? Now, I had to even ask some of them, don't you have insurance policy? Don't you have a scheme you have registered yourself for in order to subsidize this, the money you're supposed to pay? Now, take for instance, you're supposed to pay like 100 naira. Now, this scheme is out there for you to, maybe you pay as low as 10 naira. And a lot of them, they were like, no, I don't know about these things. Where can I go about them? How can I go about them? Where can I get them? And how can I get them being done? All right, so we'll be knowing much more about that, because lots of persons are always complaining, hey, going to the hospital to go do check-up, to go see the doctor is exorbitant. Now you have this health insurance for you, in order for you not to tell your doctor or to tell yourself, I can't go to the hospital. All right, so quickly now let's look at the factors that militate against this health insurance scheme, why lots of persons are saying they can't afford it. Now we'll go to costs. Lots of persons are saying it's expensive. So that's the reason why we have these persons in ground today to let us in on how we will be able to go about having ourselves insured as far as health is concerned. So you know what, let's go on a short break. We'll be right back to stay.
Your health insurance is an important tool in creating a healthy life. And to use it to its fullest potential, you need to understand the basics behind your benefits. Today, we're going to talk through everything you need to know about your health insurance, including what it is and why you need it, how to use it, where you can get it, when you can enroll, and more. Health insurance helps you pay for medical care when you have an illness, injury, or when you seek preventive services to stay healthy. Most plans help you pay for services like preventive care, hospitalizations, prescription drugs, vaccinations, lab work, primary care, specialist visits, and more. Essentially, health insurance is your connection to the care and services you need to get and stay healthy for any and every phase of life. Whether you're young or old, have few care needs, or have a chronic condition, health insurance is important. Without it, routine services and serious health issues can become very expensive. If you want to have access to the health care you need health insurance. So now that you know what health insurance is and why you need it, let's talk about how to use it. Health insurance works by splitting the cost of healthcare between an individual and the insurer to pay the provider. Prior to receiving healthcare, you will show proof of insurance to your provider, which is typically an ID card. This will tell them what kind of coverage you have and how to bill or charge you for your visit. Now that you know how to use your coverage, let's define some important terms you need to know regarding the cost of health insurance and how you and your insurer pay for care. The first financial term you need to know is premium. Premium is the amount you pay each month for your health insurance coverage, even if you don't use it. Think of it as your monthly bill for your health insurance, similar to a monthly payment for car insurance. Your premium amount is determined by several factors, which include age, location, tobacco use, your dependents, and your plan category. Next, you need to know the definition of a copayment. A copayment, or copay, is the fixed amount that you usually pay at the time of medical service. It's important to note some plans may not have a copay. Your copay can vary depending on the type of service you receive. For example, a copayment for seeing a specialist may be more than a copayment for a visit with your primary care provider or PCP. A PCP could be a doctor, physician's assistant, or a nurse practitioner. Okay, now let's talk about your deductible.
All right, in case you just joined us, this is Healthy Living, and we're looking at access to affordable health care, reducing maternal mortality through health insurance. Like I was saying before, yes, a lot of persons, they actually don't know about health insurance. So we have two personalities with us today that will be doing justice to that, educating us more about health insurance. First off, we have the person of Deacon Dr. Theodore Usa Ihanire. He is the State Coordinator, National Health Insurance Authority, Edo State. He is a health insurance expert. Good afternoon, sir.
Good afternoon, Oleji.
Okay, and also Dr. Ighariva Oluwabumi Elizabeth. She is the head Standard and Quality Assurance Edo State, and she's also a health insurance expert. Good afternoon, ma'am.
Good afternoon.
Okay, now quickly, we're talking about health insurance. And looking at the first one, access to affordable health care. Is health care really affordable in our country, Nigeria? Starting with Dr. Theodore.
Thank you very much, Oloije, for this. Good afternoon, everyone there. Healthcare is not actually very affordable as we speak right now in this country. Not only in this country, everywhere. Healthcare is not affordable at all. That is the reason that people need to understand how they can make it much easier for them through the health insurance platforms.
Okay. Now, when we look at healthcare, let's talk to Dr. Oluwabumi. Healthcare. What is healthcare? Health insurance.
If you are talking about healthcare,
yes, embedded in health insurance.
Okay, with regards to health insurance.
Yes.
Healthcare with regards to health insurance would mean that the enrollee, that's the person who is going to be involved in the health insurance as a means of payment for his health care,
yes,
is already insured. Let me put it this way, that health insurance is a form of mechanism for payment for health care. So you could have out-of-pocket payments in which the person would, at the point of needing health care, bring money out of pocket to pay. But for the person who is using health insurance as a form of payment, it means that it is not at the point of needing health care that you are bringing out money out of pocket, because it's already paid for.
Okay, I can remember an instance while I was in the hospital. I found out that a lot of women actually don't know about the different health insurance schemes we have in, let's say, Edo State, for instance. We find a lot of them already crying. How would they be able to pay their hospital bills? So I don't know, how far has the health insurance gone to make the vulnerable understand that these schemes are there to ameliorate their sufferings?
Thank you very much. You see, this is the essence of, one of the essences of our being here today. And I want to appreciate ITV for always been in the forefront of this kind of advocacy. Many people are not aware of health insurance platforms and policies in the Edo State as we speak. You see, we have, in the health insurance ecosystem, we have both the national health insurance, we have the state health insurance, and we have the private health insurance. And according to the Act of the National Health Insurance, which states that every Nigerian and legal residents in Nigeria ought to have one form of health insurance or the other, be it the national, the state, or the private. So when these people are aware, when this information gets to them, and they know that health insurance is there, then the issue of affordability will be a thing of the past. But the first thing is let the people be aware that we have this category of insurance, both at the national level, the state level, and at the private level. Even at the national level, like you made mention of the vulnerable.
Yes.
There is a program for the vulnerable in the national health insurance. The pregnant women, the children under 5, the elderly, the poor, and now there is a new twist in it, which is the comprehensive emergency obstetric care. We even have the fistula. We even have this fistula. These are programs lined up by the health insurance ecosystem to ensure that maternal mortality is reduced. So if they can know this and key it into any of these platforms, then we are good to go. We'll be heading for what we are preaching about now.
Okay, now let's talk to Dr. Oluwabumi. Why I'm actually, talking or asking this question now is, when we go to hospitals, especially public hospitals, we find out that these questions or these things are being asked. Do you have representatives that go to maybe like during the antenatal clinic or a specific area where these things are being preached, are being made known to these persons that this is what you can actually do in order for you not to suffer as much as you can or you will at the time of, you having your children?
For now, as much as possible, what we do is liaise with the healthcare facilities that are accredited.
Okay.
So we use the desk officers, those who are already working and who know these people.
Yeah.
They assist in passing this message across. There are also times that we'll go to hospitals, we speak with doctors, and then they help us pass the message across. And then currently we even have a plan to begin to go to the general practice clinics of different hospitals to begin to speak to them about this program. Because without them knowing, they won't be able to key into the program. So for this year, we have that in the office.
Okay.
In addition, we also do what is called a stakeholders forum. That means we gather everybody in the ecosystem. The healthcare facility, represented by their desk officer, the CMD, we call the health maintenance organization, who are the intermediary between the health insurance and the enrollee, as we call them. Then we have the MDAs, ministry, department, and agencies, people that are also the desk officers there. We gather all these people together quarterly. They are being sensitized on what the needs are and how to go about every challenge. Here you bring up your challenges, you talk about them, and what is the way forward. So we have a forum. And we even have social media, which
to
we
help
also use
sensitize
to help
the public.
sensitize. But those ones are not still enough. This media publicity, jingles, I think will go a long way.
Okay, well, what about the rural development? How would they be able to get this information?
In the same vein too, we also have what is called the, we visit top either government officials or traditional rulers We visit them in various communities at the grassroots, because actually we want to get to the grassroots.
Yes.
And that is why in the Basic Healthcare Provision Fund for the Vulnerable, we are targeting, or we are using the primary healthcare, which is closer to the grassroots. So what we do, we carry out engagement to the traditional rulers, chiefs in the community, and tell them, gather your chiefs, gather your people, maybe on a market day or whatever, they give us an appointment, we go there, we sensitize them. We sensitize them on what needs to be done and how they can benefit from the health insurance programs that are available in the country.
Okay. Now, Mrs. Dr. Oluwabumi, we know that, of a truth, health insurance has so many benefits. For those persons that actually don't know these benefits, in as much as we know that some persons, they do know, there are so many that don't know. So can you help us atomize the benefits of health insurance?
I want to clarify, are you talking about the benefit package or what the person stands to benefit?
What's the individual?
Okay.
Because as humans, we know, okay, you come to meet me now and you want to, you know, tell me about what you're doing. The thing I would ask you is, how does it benefit me as an individual? So as an individual, because we know humans are known for wanting to know what they stand to gain. So a pregnant woman watching us right now wants to know, what will I be able to gain when I, you know, get myself involved in this scheme? What will I stand to benefit?
Thank you very much for the question. Essentially, what health insurance does is that it helps prevent catastrophic health spending.
Yes.
Such that you don't have to become poor for the sake of taking care of your health.
Okay.
There is virtually no one that would say, I'm going to keep aside this aspect of my salary
a special ailment.
For a special ailment. Nobody does that. And the ailment is not going to tell you when it is going to come. For the pregnant woman, well, it is... you would know that at the end of 9 months, I'm going to deliver. But you don't even know how the delivery is going to be. So what health insurance helps you to do is that it helps you to prevent becoming poor as a result of health spending, health expenditure. What it does is that it gives you no fear at any time you need health care. You are sure that getting to the hospital, you are not going to be asked, come and pay for card, come and pay for consultation, come and pay for your delivery. All those are already taken care of. In fact, even if it is surgical intervention the person needs, it's already taken care of. So you are not having that headache of, how am I going to get this money? Because that is part of, if you look at maternal mortality, for example, one major factor that contributes to maternal deaths in this region is that, one, the person doesn't even know, how am I going to get this money to take care of, apart from all the other issues that we can talk about. The person deciding to access care, even after having decided access to the place of the care and all that, those are issues. But first of all, the person thinks of, how am I going to bring this money out? So you find out women, instead of going for proper antenatal care where they are well taken care of, because of the finance not being there, they will decide, oh, let me go to this particular person, and then the person is not experienced to take charge of the care of the woman. And so you begin to find when complications now set. But if the woman knows that getting to the facility, all I need is present myself, and that is what insurance does for you, because it's already paid for.
Okay. All right, now when we say it's already paid for, Mr. Theodore, are we saying as an individual, if I'm supposed to pay 100 naira, maybe in total sum, the hospital gives me 100 naira, as an individual, what will be the money that will be coming out of my pockets?
Okay. When we say it's...
Being that I'm insured.
Good. You know that for every insured person, there's a premium that is being paid.
Okay.
It is that your premium that qualifies you access to care. Now, in the health insurance, once you are already enrolled into the system, there is what we call a co-payment that is made once you are treated. And that co-payment is on drugs that we administer to you.
Okay.
It is there as a mechanism to stop people abusing the system. That is why the 10% co-payment is there. Okay. And I want to make it clear, you know, some people go to the hospital to access care, and at the end, haven't done everything. They tell them to pay 10%. Both consultation, they just, no, it is not like that.
Okay.
Consultation is already paid for through a capitation mechanism that we have. What the patient or the enrollee now pays for is 10% of drugs.
Drugs, okay, being given.
Being given.
Okay.
10% of drugs.
And not the consultation.
Not consultation, not the
okay.
total treatment.
Okay.
Some we even do tests and ask them to pay.
So, so if one is insured, that means you can actually walk to your care provider,
yes,
right, and say you want to go for checkup, and it will be done for free, right?
Yes, yes. But your checkup, you cannot just walk into and say, I want to do checkup. There must be something that you are presenting. That
you want to do the checkup for?
Yes.
Okay.
Once it is done, there are guidelines. Just like every other, like the country have a constitution, we also have what is called the operational guidelines. So through the operational guidelines, you know what and what you are entitled to. There is a benefit package for everyone. For all the programs in the health insurance, there are benefit packages for them. Okay. So like the basic healthcare provision for, there is a benefit package. For the teaching for the student, there is a benefit package. For the formal sector, there is a benefit package. Okay. Organized private sector, there is a benefit package. General benefit package, only that how you come in, the route that you use in coming in
matters a lot.
Is what is the difference. So everybody come into the pool and we enjoy the benefit package. Okay.
All right. So before we go now, Dr. Oluwabumi, your advice to women out there?
For all women out there, I would advise that do not prepare for your health at the point of needing care for your health. Prepare ahead. Okay. Don't take action at the time when you need it. Not just for yourself as a woman, even for your children, for the whole household. Very important. So I would say please key into health insurance. It saves a lot of hassles. Okay. It saves a lot of trouble.
All right, thank you so much, Dr. Oluwabumi. So Dr. Theodore, your advice?
Well, like Dr. Bumi has already said, we have different intervention under the health insurance ecosystem. Yeah. Especially talking about reducing maternal mortality. Yes. They should be aware of such programs as the CMOC. I'm particular about this. That is comprehensive emergency obstetric care. If they can avail themselves with such program, it is virtually free. Because once they avail themselves of such program, they will also be registered with the state health insurance for care to continue. All I just want them to do is make themselves available at the point when they hear something like this.
Okay, okay. All right, big thank you to Dr. Oluwabumi and, of course, Dr. Theodore. They are health insurance experts. You want to definitely know more about this, yes, they'll be letting you in on health tips and how to get along with that. All right, so we'll be seeing you again next week for another exciting time. Remember, health is wealth.